So by now we've heard of how countries around the world are using data from people's phones to slow the spread of COVID-19, to track and trace people who may have come in contact with someone who tested positive for the coronavirus, to make sure that people are staying home and quarantine when they're supposed to, and to see if social distancing measures are working. And these initiatives have been rolled out with varying degrees of success and respect for privacy. Canada hasn't started doing this yet, but government officials are considering it. So today, we're going to talk about what that effort could look like and whether cell phone data and tracking could actually be useful in the COVID-19 outbreak here. My guest today is Dilshan Kathriarachchi. He's the Chief Technology Officer of EQ Works, a location analytics company based in Toronto, and he also happens to be my roommate. I'm Tamara Kendacker, and you're listening to Wait, There's More. Hey, Dilshan.
Hi.
Thanks so much for doing this. I usually record the show in your closet, but there's not enough space for both of us in there, so we're doing this in a room. So I guess full disclosure, we are roommates and we're good friends, but we've been talking about the coronavirus all the time.
Every day.
Our place is basically like a coronavirus news network. I've been thinking a lot about how governments have been using data to tackle this pandemic, and we talk about this a lot, and I thought it would be a really good time to bring you on the show because you're kind of involved in this effort right now that's kind of
At least trying to be.
At least trying to be. So a lot of countries are leaning on data from people's phones to stop the spread of the coronavirus. Canada hasn't done this yet, but Trudeau has said that nothing's off the table, and the government has put out a request for proposals to help stop the spread of COVID-19.
All options are on the table. If people do not comply with expert advice and government guidelines, we will have to take additional steps.
And I know the company that you work for has made a proposal. And so can we start with a bit about the company and what it is that you do?
Yeah, for sure. So the company is called EQ Works. We've been around for about a decade. In that time, what we've done is help businesses understand how their customers interact with their physical locations, right? So who's walking in, what stores are doing better, where you should open your next store, why some stores are doing better than others, that kind of thing. And it's probably the very first time that all this work that we've done around machine learning and AI has had some national relevance and being able to apply some of that work towards helping with this particular crisis.
So tell me about what it is that you're proposing to the government.
So I wouldn't characterize it as a proposal, but as a point of view, because I think there's a lot of solutions that are out there, and ours is obviously one of them that we are suggesting. It's modeled after the Singaporean model. They built out an app called Trace Together, took a fundamentally different approach to the rest of the world, and I thought that was really interesting what they tried to do. They built an app that leverages Bluetooth as opposed to GPS, fundamentally very different, collected as few information as possible, stored a lot of that on the device itself, and encrypted it. So it records it, it's almost like a journal, logs it on your phone, doesn't send it out to anyone.
In this app, if two people have the app installed, there is a Bluetooth handshake between their phones, but their phone numbers are not exchanged. There's no geolocation data involved, and personal identifying data is not exchanged either.
The moment someone gets a positive diagnosis, the government gives them a PIN. They are completely opt-in, consent-driven. You get to make a decision on whether you punch in that number onto your mobile application. The moment you do that, it then sends that information out back to the government, the Ministry of Health in Singapore. And they make a decision on to propagate that information to everyone else that has that application, saying, hey, you may have been in contact.
When the process is activated through MOH for contact tracing, it still requires an interview. It still requires that professional judgment of the contact tracing team, but hopefully it starts the process earlier and hopefully allows it to move much faster. And the app then therefore augments our contact tracing professionals.
So basically, what Singapore has done is created an app which would be able to tell who I was close to, but not where I was.
Exactly. Where you were is kind of irrelevant if you know who's been in close proximity to each other.
Mm-hmm. And the way that you're thinking about this, who would have access to this information?
Only the public health officials really need that information, and the exclusive purpose of it should be contact tracing, right? So the moment someone gets diagnosed, how do you find everyone else? That needs to be tested or at least self-isolate to a certain degree.
Right. And the way that Canada is doing contact tracing right now is a healthcare worker is asking a diagnosed person to remember every single person that they've had contact with. And so you're essentially relying on someone's memory, and they may not remember people that they don't know who they've been in contact with, who they may have passed the virus on to. And so can you just kind of outline why the approach that Canada is taking right now to contact tracing is maybe not enough, not sufficient?
I think it's enough until a certain point, and I think it becomes very challenging to scale after a certain amount of time, right? Because you're depending on people's memory. Most people don't remember what they had for breakfast 3 days ago, right? Let alone all these nuanced details about how they carried on. So that's challenging. The second part is if you have 1,000 people that are being diagnosed every single day, the amount of resources that you would need to properly do contact tracing, I think, just gets bigger and bigger. And I think that's where technology can definitely help in identifying potential risk points, narrowing out resources potentially to a smaller footprint, and help save lives.
So the Singapore app, Trace Together, it IDs users within a 6.5-foot radius who've been in contact with the infected person for at least 30 minutes. Are you thinking something along similar lines?
What's happening right now is everyone's open sourcing a lot of these things. I think people are learning as they go. The Singaporean team has been very proactive in saying, hey, we are building this, but we're also going to open source it. So if any other country wants to adopt it, they can do so. I think we have to kind of figure out if those specific variables are values on 6.5 meters and 30 minutes applies to our society and the way we carry out on a day-to-day basis. But we can change that. I think just the fundamental way of operating that contact tracing model is what's really valuable there.
Yeah. And Singapore's approach to COVID-19 has been really successful so far. It seems it's being looked at around the world, and they only have 1,000 cases, which is pretty incredible for a country that's that densely populated, and they only have 3 deaths. But how did they actually use this app? Because it obviously wasn't operating in a vacuum. There's like an infrastructure around it.
I think Singapore just got really lucky that they had a software development arm of the government that activated and started building this. They have a very innovative ecosystem where people are very tech savvy and they adopted it. It was very consent driven and people had to opt into this program. And I think lots and lots of people did. They really benefited from that type of society and that type of moving quickly. And I think the value is it probably adds just enough visibility for public health officials to go and identify and isolate diagnosed cases and potentially high-risk individuals faster than you could manually.
And so in order for this technology to be effective in Canada, what kind of infrastructure would we need to build around it?
The information has to go somewhere. So you need the public health agencies to be able to ingest that information and know what to do with it. So being able to study a solution, understand the privacy implication of it, understanding the legislative implications of it is fundamentally required. We live in a very prosperous democracy. We don't want a national health crisis to undermine those democratic institutions or those laws that we have in place for a reason. So that's required. The second part of it is now that I know there's a possible contact point, I think it's the existing infrastructure that kicks into gear. The value is you potentially could get a lot more utility out of it by directing it at very specific areas, maybe neighborhoods, maybe even specific buildings or neighborhoods that could have been compromised.
So when you say the existing infrastructure, do you mean like tracing teams, essentially?
I think so. Because I think it's just more information that they're getting, right? More directed information, more valuable information, and faster. So they don't have to potentially spend time tracing, and more on the isolation and informing part.
So they would be able to identify the people who might have been exposed, and then they could spend more time making sure that those people stay in isolation, for example.
Exactly.
And I guess also testing them for the virus.
Yeah, for sure. So I think testing and even letting people know that they are potentially at high risk and they should self-isolate, I think is valuable.
So in order for this to work, you'd need people to consent and install the app on their phones, right? In Singapore, people are quite comfortable, from what I understand. In Southeast Asia in general, people are quite comfortable with the government having access to their data, but here people aren't as used to that. And the idea of their data being used for anything makes people pretty uncomfortable. How many people would have to opt in for this to be effective and make a difference?
I think people should be wary of installing any application on their phone, especially one that aggregates information like this. I think that's where potentially a government has a bigger voice there in both assessing the various different solutions that are possible and making a judgment call on whether this is on side or not is very valuable. The saturation point is hard to understand. Like, we know in Singapore it's not 100%, but it's also not a few thousand people, right? And for it to be complete enough, you would need everyone to have it, because the apps only record other people that have the app. It's not in general, it's recording every single device that it sees, because you need to understand who did I just see, even though it's an anonymized ID that's on that phone, right? So you typically want almost everyone to be able to opt in eventually, but I think you start seeing value at a midway point.
Mm-hmm. What would happen to this information after the pandemic is over?
So the way that Singapore is doing it, and recently Switzerland's adopted a very similar model, is even on the device, the information keeps getting deleted, right? So if once it loses its value after, say, 21 days in Singapore's case, it starts deleting that information. So the information disappears off the grid completely. So in the worst case scenario, 3 weeks after all this is over, there should be no information around. And the use case for that information should be highly, highly restricted to just this contact tracing. And people should even delete the app after this crisis is over.
So we've heard of a couple of other apps that are being developed in Canada. There's one, for example, from this research center, Mila, in Montreal, that would be opt-in. People would choose to download it on their phones, and the technology would let the phone record who you're in contact with.
You would be informed on your personal phone that over the course of the last, let's say, 14 days, you've been in contact with someone who has tested positive. Of course, that would be completely anonymous.
So pretty similar to what we're talking about, but they're proposing using location data. Why not use location data?
I think the challenge with GPS data is that it has a lot more sensitivity around it than I would like for something like this. If you want the whole population to opt in, you probably want the least amount of information that you need to diagnose it. But maybe you need that other information. I wouldn't definitely discount the solution right off the bat. But in most cases, at least based on what Switzerland's done, what some of the European countries are starting to do, where they have some of the strictest privacy laws, and definitely Singapore, Bluetooth seems to be an adequate solution if you can get away with it. GPS might allow us to understand how, certain buildings that have high concentration, you can add that physical location element to solving that problem without just depending on just contact. But I think people are more protective of their location, even in this kind of setting.
The way that I understand the value of using GPS data is, like, say someone got sick in this apartment building, which they did, and I hadn't come into contact with that person. I hadn't been in a 6-foot radius with that person for over 30 minutes, but I've been in this building and they've touched surfaces in this building. That's where it would be useful for me to know that it happened here.
Yeah, except you go after and then try and test everyone in the building just because you co-located in close physical proximity. I think that's the challenge for just GPS, because especially in urban areas where you have condo buildings and big office buildings, just because you were close together doesn't necessarily mean that you would have had contact. Could have been on opposite ends of it. You wouldn't have used the same elevator, and you wouldn't know any of that information with just the GPS data.
But are there privacy concerns around... Like, I understand the privacy concerns about knowing where someone was and people being uncomfortable with that. But even with this idea of proximity, doesn't that reveal potentially who you're associating with?
It definitely does. Most of the solutions are anonymizing it. So you're not broadcasting anything that can be traced back to you. It is just a anonymized ID that gets generated when you install the application. And that just stays on your phone. And that information only becomes useful when reports saying, hey, I got a positive diagnosis. Then each application is just trying to find out, have I been in contact with someone that was positively diagnosed? At that point, that data becomes, or that information, that journal becomes incredibly valuable. And that's when, again, consent again before you upload any of that information. Some people might choose not to upload that information, that they're not comfortable with it. And they should have that choice.
Where are you at right now in terms of talking to the government?
So very early on, there was an procurement RFP process saying, if you have any ideas for, and if you do any services that can help the government, most of it would have been around personal protective equipment and ventilators or anything that the government needed very rapidly. And then a secondary set of services that could help with the fight. And we felt that some of the technology that we built over the last couple of years had applications in this particular domain. We're also governed by Canadian privacy laws, meaning that we've taken those into account as we built it, and have people that understood this problem and understood the human movement as a fundamental information set. So we reached out, we gave some proposals into that process, and then we've been in contact with many different levels on what solutions are possible using what we have.
Yeah. When you say different levels, you mean like federal, provincial, and municipal levels of government?
Yes. So both the federal government as well as provincial governments have been very aggressive in trying to find solutions and then reaching out to the private sector through various different mechanisms that were already in place.
We'll be right back. So other countries are using location data to do a variety of things. So track and trace people who've been infected and their contacts, which is what we're talking about.
Yeah.
And then also to understand whether or not social distancing is effective, and to make sure that people are staying in quarantine, staying in isolation. And I want to talk quickly just about approaches that other countries have been taking. So South Korea had a big outbreak, and they've been successful at flattening the curve. And what they've done is they've built a map that tracks the movements of people who've been infected. And they've not just used data from people's phones, but they've also used data from their credit cards, CCTV footage, and face-to-face interviews with patients to figure out where they've been. And then they've sent text messages out to the public to let them know when there's a new case in their district, and then the public can see very detailed information about where that person went and whether they were around that person. And they don't release the infected person's name, but they do share their gender and age. And then people who believe they might have been exposed to the virus are urged to go and get tested. So why not do something like that here?
I personally wouldn't be okay with that being done here. I don't think a lot of Canadians would be okay with that. And I don't think it'll be in direct violation of most of our privacy laws in place.
Okay.
But they have definitely been the most, you call it multi-source contact tracing, meaning that you're not just depending on one source of information, you're tapping into financial transaction records and everything under the sun by the sounds of it. But you don't need to do that. I think especially giving information back to individuals on movements in that neighborhood, I think that's way overkill for solving it. And I think our society is not built to have that kind of structure in place, for sure.
They've had a lot of problems with that too. It seems like the information's supposed to be anonymized, but then people have been able to connect the dots essentially and figure out this person's been in an affair and use that information for all sorts of other things.
Which is why the way that you would implement this type of solution is that the only people that should have any visibility is public health officials and the agency. And even then, it should not be everyone's information all the time, only people that are relevant to fighting the epidemic. Mm-hmm. And I think, which is where the apps, I think, are a good solution, because it gives a sense of control and transfers that control back to the individual.
Another really dramatic example of how governments are using location data is Taiwan. So they've created essentially an electronic fence around quarantined houses.
Those considered low risk were sent a pass via text message allowing them entry. Anyone considered high risk was put into quarantine at home, tracked using their mobile phones to make sure they stayed there.
So if you leave your house or you turn off your phone, the police are alerted and they'll contact you or come to your house within 15 minutes. And because they've been so strict about quarantining people and they seem to have their outbreak under control, they've been able to maintain some sort of semblance of normalcy. So kids are still going to school and they haven't had to do a full lockdown of the whole country. What do you think about that?
I don't agree with that, and I don't think my company agrees with that either. I'm personally against technology like this being used for policing. I think there's value in identifying at-risk Canadians, informing them of potential risk, and helping them to either test themselves or self-isolate to help flatten the curve. You don't want to use this type of technology for policing, and I don't think Canada will adopt that at all.
And that's, I guess, like what people are really scared of.
As they should
like
be.
This. Yeah.
Adding a policing element will probably scare a lot of people away from participating. Whereas I think if you look outside, people are self-isolating. They are taking it very seriously. They want to get back to normal as soon as possible. I think most Canadians would participate in a consent-driven initiative just because they want to get back to normal quicker.
What about concerns that this is a slippery slope? Like, you can make a strong case for using this technology for this specific purpose, but how do you make sure that it doesn't get out of control?
I think the consent aspect kind of locks it into this particular scope, meaning people are going to download this because there's a pandemic out there and they want to help. And when that's over, they're going to delete that app and move on, and there won't be any data. There won't be any information being collected. The exercise ends there, which is why consent-driven systems are much better than something that collects that information a bit more passively. Mm-hmm. And I think if we can get away with not tying personally identifiable information to these records, again, the data will be a lot cleaner, and you can use it for understanding the pandemic without compromising anyone's identity.
Do you feel like the Canadian government's taking too long to get on this and to start using data to track and trace people? And how long do you think it'll be before we actually adopt this technology?
Personally, I'm glad that the government's not jumping into this without giving it the necessary diligence around it. Like, we don't want a South Korea kind of solution, right? And I think the Privacy Commissioner has been very proactive in also putting out a bulletin saying the office interprets privacy laws during COVID-19. I don't think we should undermine our democratic institutions or even privacy laws and legislature that's there just because we're in the middle of a crisis. So the challenge for us would be, how do we move as quickly as possible within the frameworks that we have? And I think I want the government to take its time before it figures out what the right solution is, or even whether it's appropriate.
But at the same time, we don't seem to have a lot of time here. Like, this is getting worse every day.
It definitely seems to be. The only thing that keeps me very optimistic is, of all human elements within this, I think ideas seem to be the one thing that propagates probably faster than this virus is right now. Everyone sharing their own learned experiences and all these different countries learning from each other and companies learning from each other. I think there's a solution there that we can adopt.
Well, thank you so much.
Thank you for having me.
All right, that's the show. I just want to note, we did reach out to Health Canada and the Privacy Commissioner about all of this, but neither of them got back to us in time for this episode. But in a previous statement to the Hill Times on proposed apps to track the spread of COVID-19, a spokesperson for the Federal Privacy Commissioner's office said, quote, "During a public health crisis, privacy laws and other protections still apply, but they're not a barrier to appropriate information sharing, and that existing privacy laws for data collection, use, and disclosure can ensure that it's done in a responsible way that supports public health." Also, I wanted to flag a pretty grim milestone in the COVID-19 pandemic. The total number of coronavirus cases around the world has now reached more than 1 million. Sorry to end on that note, but that's all for today. I'm Tamara Kandakar, and I'll talk to you tomorrow.